He's known as the plastic surgeon to the stars. With us again is Dr. Michael Fiorillo. Welcome again.
Thank you.
You worked on a mob wife.
Yes.
Right?
Yes,
and
I did.
I don't know what happened. You're going to tell us the story a little bit, but she came to you after some traumatic experience with the surgery. So
she had a procedure that was called the body lift.
right.
Where
And who is it? Renee
Graziano.
Gotcha.
She is one of the stars of the Mob Wives, which I think is on season 5 now. And she had a tummy tuck where they extended all the way around to the back. So they basically take a donut of skin out in the midsection
right.
and kind of pull everything up. Common procedure. Post-operatively, the back had completely split open right in the recovery room.
Wow.
And she had bled a lot, and she ended up getting transfusions, and she was in the hospital. So at that point, she had called me to see if I would take over the care, which I did. And she was left with a pretty large size hole in her back that we had to do some wound care on, and we eventually closed.
Right?
We eventually closed it. So, but the thing about that, and she was very good about it, was about just educating. And she said to me afterwards, like, I never knew that could happen. And that's part of the whole informed consent. So when you go in for a procedure, you should know everything that can go wrong or has gone wrong, so you're prepared for it.
So there's a risk. However, that doesn't always happen
No.
to people, and 9 out of 10 times it doesn't happen to people, right? Is it?
Probably 99 out of 100,
Right.
but it is very small. But when it does happen, a lot of people's response is, I didn't know that could happen.
So, right. So what I like you do is that you educate your patients so that they know what to expect and they're prepared, and then they can make an educated decision.
Absolutely. We always try our best to prepare patients, and of course we all want everyone to be 100% happy and a perfect
Right.
result.
Right. Gummy bear lifts. What a crazy name. So where do they get the name, and what is it?
So their breast implants started in the 70s with silicone implants.
Right.
And now the new implant is the 5th generation. So I kind of equate it like the iPhone. You know, there's like now it's up to iPhone 6.
Right.
But Gummy Bear is a nickname for the new implant. So it's the 5th generation of implant. It is silicone, but it's a more form-stable silicone. And a doctor in California coined the name, oh, it feels like a gummy bear. So we call it a gummy bear implant. So when it's in the body, though, it's soft and it's natural, but the silicone holds its shape. And the nice thing
not
about
like the silicone in the past.
Years ago it was liquid.
Right.
And if you remember in the 80s, 70s and 80s, they were leaking, and it was like liquid silicone. And there was problems with that implant. So now the leakage rate is extremely low, the rupture rate is very low, and in theory it doesn't really rupture because it's not a liquid. So they've been in the US now for almost 3 years, about 2.5 years. They've been in the rest of the world for approximately 13 years.
Wow.
Yeah, and they're excellent. I've done 300 of them now. They're just really nice implants. They look great, they keep their shape, they stay in place, and it's a really nice advance.
And they have a catchy name that everybody comes in and asks you about, right?
They do, and they're really, really good for breast reconstruction. So if a woman, you know, has a mastectomy, unfortunately, and needs a reconstruction, it's great for that.
What other non-surgical procedures are that you do? Because you do so much, and you have a spa too, correct?
Yeah, so non-surgical now is very large, you know, probably, you know, just as big as the surgery part of my practice. And when I started 16 years ago, most of this wasn't here.
Right.
So, you know, technology has hit our field, which is great. So I do a lot of injectables, which is great. Used to be only Botox. Now there's 3 of them that are on the market.
Different kind of...
3 different kinds of neurotoxins, we call them.
Okay. And there are fillers, too.
And then there are fillers, too, which kind of fill back in what's lost as we age. And they fill and lift at the same time.
I'm ready for...
So those are non-surgical.
How do you know, how does a woman know what to choose? Do you help make that decision based on their face, or what, how do you make it?
So during a consultation, the consult now, you know, years ago used to be just facelift.
Right.
And now you can start with fillers, and then there's laser, and then there's skin tightening, then there's a mini lift, like a little small little facelift, and then there's a full facelift. So it kind of goes, you know, from mild to wild, if you want to say. But you can start with very simple stuff that, you know, very low risk, and a lot of people won't even know you had done, and just natural, all the way up to having like a facelift.
Thanks so much, Dr. Fiorillo. My pleasure to have you here today.
Thank you.
Next up, she was a perky, ponytailed castaway stranded on the island for several years. After the break, we'll talk with actress Dawn Wells, best known as Mary Ann from Gilligan's Island. Wait for us, we'll be right back.